Hi guys, how are you? I'm Christian Dulutina, RCW student here in Margaret Canoli Training and Consulting under Resident Care Worker Program here in Summerside, Prince Edward Island, Canada. Alright, for today's video, I'm going to discuss what do kidneys do, what are the kidney function, what is renal failure, which we have two types, acute renal failure, chronic renal failure, and what are the causes of renal failure, symptoms of renal failure, what are the risk factors, and then what are the complications and effects on the body system, the prevention of renal failure, the diagnosis of renal failure, treatment of the end stage of renal failure, and what are the RCW roles and intervention, the person-centered care, the statistics here in Canada, and many more. Alright, the purpose of this video is to provide a better understanding of health-related condition and how healthcare team come together for caring a patient and to improve the quality of their life. Our kidney is a bean-shaped organ about the size of our fist that sit under our rib cage towards our back. Most people have two kidneys. We have right and left kidney. But some person will leave only one kidney as long as it is functioning well. For the function of the kidney, we have filter waste like urea, creatinine from our blood, regulates fluid and electrolyte balance like potassium, sodium, and calcium. We have maintains acid-base or pH balance, and then produce hormones. For the structure of the kidney, we have the nephron, which is the functional unit, and there is 1 million nephron in each kidney. And inside the nephron, there is a glomerulus, which filters blood. We have leukopanel, which secretes and absorbs substances, and tubules to concentrate the urine. This is now my 3D model. I made this one, and this is the label, like the left kidney, right kidney with the inferior vena cava, aorta, the cortex, medulla, renal artery, renal pelvis. This is the left kidney, the renal vein, and then the right kidney, and we have the urethra, bladder, and the urethra. So here is the how the kidney function. So I'll remove this, and imagine this is the blood. Blood will go to the aorta, and the blood will go through the kidneys, and it will filter waste. It will filter the blood, and then the filtered waste will go to the urethra, and then it will go to the bladder, and then when the bladder will be full, you will sense that you need to pee, and then urethra will be relaxed and excrete the waste. When our kidney don't function properly, waste product will build up in our body, and this is called renal failure. Alright, there are two types of renal failure. We have acute renal failure and chronic renal failure. Let's talk first about acute renal failure. It is a sudden onset, sometimes temporarily, and develops quickly up to hours to days. And this renal failure is reversible as long as the cause is treated. While the chronic renal failure is gradual, progressive, and irreversible renal failure and can take up to months to years. And then kidney, when kidney is permanently damaged, it can lead to end stage of kidney disease. Alright, there are three causes for acute renal failure, and it can happen in pre-renal, which is before the kidney, intrarenal, which is kidney itself, and then post-renal, after the kidney. Alright, for acute renal failure, we have three causes. First one is pre-renal, which happen before the kidney and slow down the blood supply to the kidney, like dehydration, which is lost fluid of the body, blood loss, heart attack, heart disease, liver cirrhosis, and anaphylaxis, bad burns, and many more. Alright, the next cause for acute renal failure is the intrarenal, which happen within the kidney itself. It includes swelling, irritation, and inflammation on the kidney, which called glomerulonephritis, medicine like chemotherapy medicine, infection, toxin like heavy metals and alcohol. We have tumor, we have failure in immune system like lupus, and then breakdown of the cell or called tumor, and also the blood clots of the arteries and veins within the kidney. Alright, the last cause for acute renal failure is post-renal. This condition will keep our urine leaving from our body, which is called urinary obstruction. This includes kidney stones, enlarged prostate, blood clots on the urinary tract, bladder cancer, prostate cancer, cervical cancer, and other tumor that pushes our ureters. Alright, now let's talk about the causes of chronic renal failure, which include all the causes of acute renal failure from pre-renal, intrarenal, and post-renal, but we will add the type 1 and type 2 diabetes, high blood pressure, heart disease, and glomerulonephritis, which is inflammation of the kidney, the polycystic kidney disease, and many other diseases in the kidney. Alright, now let's talk about the signs and symptoms of both acute renal failure and chronic renal failure, which include less urine output, fluid buildup like edema, which can cause shortness of breath and swelling of the arms, legs, and feet. We have confusion or trouble concentration, fatigue and tiredness, weakness and muscle cramp, nausea and vomiting, loss of appetite, itchiness, and sometimes there is no symptoms until it's too late. Alright, let's talk about the risk factor of both acute renal failure and chronic renal failure. But I will say to you that renal failure almost linked to other medical conditions. And here are the risk factors. Older age, but it can also happen to the children. We have blockage of blood vessels in our arms and legs called peripheral artery disease. We have high blood pressure. We have heart or coronary artery disease. We have liver disease, smoking, obesity, and we also have medication that can damage your kidney, and also family history and many other diseases like cancer. Alright, here are the complications of renal failure and effects on our body system, which include the fluid retention, which can cause swelling in our hands, our legs, and our lungs, which is called pulmonary edema. And next is pH imbalance, electrolyte imbalance, hyperkalemia, which is sudden rise of our potassium level in our blood. We have anemia, we have heart disease, weak bones, we have damage in our central nervous system, which can cause personality change and seizure. We have decreased immune response, which can increase the infection. We have pericarditis, which is inflammation of the perigium layer of our heart. And we have the end stage of kidney disease, and eventually can lead to dialysis and kidney transplant. And lastly, death. Alright, here are the prevention to reduce the risk of kidney or renal failure, which is follow the instruction of the over-the-counter medicine, manage your health condition with a doctor's help, manage your healthy weight, don't smoke, have a healthy lifestyle, be active like exercise, eat healthy diet, and improve your holistic well-being. Alright, here are the diagnoses for renal failure. These are the following tests to know and to diagnose if you have renal failure. This includes blood test to check your level of urea and creatinine in your blood, the urine output measure, which measure your urine in 24 hours, and then urine test, which called urinalysis, and imaging test includes ultrasound, CT scan, and imaging. And lastly, we have biopsy, which remove your tissue kidney sample to test if you have renal failure. Alright, here are the treatment for the end-stage kidney disease. If your kidney doesn't keep up with the waste and fluid clearance on their own, you will be develop a complete or near complete kidney shutdown. And this is called the end-stage kidney disease. And eventually at this point, you need a dialysis or kidney transplant. Dialysis is a treatment that does some of the jobs of the kidney. It removes waste products and fluid buildup from the blood. When a person's kidney are failing, they are given information to help them decide if dialysis is right for them. There are two main types of dialysis called hemodialysis and peritoneal dialysis. During hemodialysis, a tube is connected to a large blood vessel, usually in the arm, through the plastic tube attached to the body at the neck or groin. Blood passes from the blood through the tube into a dialysis machine. The machine filters and cleanses the blood and removes extra fluid. The clean blood is then put back into the body through another tube. Most people have hemodialysis several times a week. Each session lasts few hours. Hemodialysis can be done at the dialysis unit or at home. During peritoneal dialysis, the blood is cleansed through the inside lining of the tummy called the peritoneum. Peritoneal dialysis works by putting soft tube called a catheter into the tummy. This tube stays in all the time and special liquid goes through the tube or catheter into the tummy. This liquid pulls waste and excess fluid from the blood to cleanse it. After few hours, the special liquid is drained out in the body and it is replaced by a fresh liquid. The dialysis liquid can be changed manually or few times through the day. Another option is to use machine to do these liquid swaps overnight. Peritoneal dialysis is done at home. Many people need dialysis for the rest of their life. If someone is okay to have kidney transplant, they may need a dialysis until a compatible kidney is found for them. Kidney transplant. On year 1954, it was the first successful kidney transplant. It involves surgically placing a healthy kidney from a donor into your body. Transplanted kidney can come from deceased or living donors. The deceased kidney may be left in place or removed depending on the case. The donor kidney is implanted into the recipient's lower abdomen. The ureter of the donor kidney is then connected to the recipient's bladder to allow the urine drainage. Once the vascular and urinary connections are made, the surgical team monitors the kidney perfusion and urine output to ensure the proper function. After a transplant, you need to take medication for the rest of your life to keep your body from rejecting the new organ. You don't need to be on dialysis to have a kidney transplant. Alright, here are the effects on the family if you have a renal failure, like stress over the diet and dialysis schedule. We have emotional fatigue, like for the chronic care, and we have financial strain due to treatment costs, and we have conflict of the schedule of time and transportation for the dialysis schedule, which is 3 to 4 times a week. Alright, as an RCW or resident care worker, this is our roles and intervention for kidney or renal failure patient. First, we need to monitor their vital signs. Next is monitor their urine output, monitor the intake and output, monitor their weight or weigh daily. We have be knowledgeable on the signs and symptoms, assist in their hygiene or activities in daily living, assist in their eating, medical support like assist or make sure adherence of the medication. We have dialysis support, which we prepare the patient and observe the complication. We have emotional support. We need also reassurance, safety, calm environment, and also support. And lastly, we need to ORR and DAR. Alright, for the PCC or person-centered care, we need to respect the resident or the patient for their decision if they need a dialysis, if they need transplant, or if they need only the comfort care, and then maintain dignity during treatment, promote individuality like culturally sensitive diet, and then promote the quality of life, privacy, safety, understanding, communication, and also promote the holistic approach of their life, physically, mentally, emotionally, spiritually, and intellectually. Alright, these are the statistics of kidney disease here in Canada. There are 1 out of 10 Canadians having a kidney disease, and 45% of diagnosed in kidney disease is under 65 years old, and there is no cure in kidney disease. Kidney disease can increase your risk of heart disease, and diabetes contributes to 38% of kidney failure requiring dialysis, and kidney disease was the 11th leading cause of death here in Canada. Kidneys are vital organ that require for survival and improve the quality of life, so you need to protect it, eat healthy, and love yourself. Alright, this is our end of our video, and in my conclusion, what intrigued me the most is how the kidney function well and how kidney vital or important in our body system, and how the kidney disease develop, what are the signs and symptoms, the importance of our lifestyle, the importance of the early diagnosis, and what are the risk factor and complication, and also the prevention. And the most important thing I learned is what are my roles as an RCW to help the patient or resident in the future or now to improve their quality of life. Thank you. Alright guys, that's it for today's video. Thank you for watching. Keep learning and enjoy.